It is imperative or it is important to control the sugar level at earliest level. Welcome to our channel. I am Dr. Mahathur, fellow American College of Clinical Endocrinology, practicing endocrine disorders, primarily diabetes and thyroid disorder. Now, with the advancement in age, the life expectancy is going up due to increase in healthcare system and the quality of life being improved. There is an increase in the disorders, particularly of metabolic disorders. The metabolic disorders are diabetes mellitus, essential hypertension, coronary artery diseases, obesity, and dyslipidemia, means cholesterol level going up. So we are now presently we are focusing on the diabetes mellitus. So what is diabetes mellitus? India is also known as a capital of diabetes in the world, because there's a number of patients diabetes are very high. So diabetes is a disease of sugar metabolism, meaning by the sugar which we take in our diet or the sugar which is produced in the body are not been metabolized adequately to maintain the normal sugar levels in the blood. So what is the normal blood sugar level? When we see a patient to examine, so diabetes can only be diagnosed by blood sugar, by examining the blood sugar. The normal blood sugar, the fasting levels are about 100 or 110 to the upper limit. And the postprandial, the sugar after eating something or a random sugar should be less than 140. So having known the normal values of sugar, we should now examine the blood sugar level of the population who we suspect to be having probably diabetes mellitus. The population which falls in this category is, and of course we talk about elderly people, A, B, those people who have strong family history of diabetes, those people who are having recurrent infection or they symptoms like losing weight, tiredness, increased urinary frequency, increased appetite but losing weight, and these are the symptoms generally point towards something going on a metabolic disorder. So once we do a blood sugar and we find out the sugar levels are not normal as we discussed before, we should now put them into a category of diabetes mellitus and should try approach to treat them and to bring their sugar level to normal. Well, how should we do that? What are the measures we should take the blood sugar level to normal? Before we doing the treatment part or measure to do the blood sugar level, we should also know what harm it will cause if the blood sugar level remains high for a longer time. A, the blood sugar if remains high, it firstly affects our small vessels like micro vessels, which means affecting your eyes, affect the kidneys and nerves. And these impact or these effect, if caused adversely, are long lasting. Firstly, diabetes can be controlled, but the diabetes related complication in eyes, kidneys and nerves remains more or less permanent. So it should be important to control the sugar level at the earliest stage. Other complication of diabetes it affects your heart, it's coronary artery diseases and can cause stroke, and maybe sometimes recurrent infection in the body, peripheral vascular diseases, there's something known as the diabetic foot. So all these complications are generally can be prevented if we control the blood sugar levels. Now, second aspect, after we know that blood sugar is so harmful if it remains high, or diabetes is so harmful if it remains for a long time, can cause complication as we mentioned just now. We should try to control the sugar level at the earliest opportunity. Here I like to mention one more word, the legacy effect. Legacy effect means if the blood sugar remains high or if diabetes remains uncontrolled for longer time, they causes complication at later date also. So it is imperative or it is important to control the sugar level at earliest level. The measures to control the sugar. The first and foremost thing is that we should bring down lifestyle modification. Meaning by first thing, there should be a diet control. The patient should be advised. Before we go there, we must educate the patient. What is diabetes? How it is happen? and how can we control them. So dietary exercise, dietary restriction are very important, and once the dietary restriction means there's a less carbohydrate, balance, increase less carbohydrate, increase fibers and balance protein. So these balanced diet to be calculated and advised to the patient so that they take a balanced diet. And another aspect for lifestyle modification is regular physical exercises. As it is advised, about 150 minutes per week physical exercise is a good exercise. And of course, exercise should be done within the cardiac acceptance of the person. So he should not overdo it, but must maintain a regular exercise to do it. After the exercise, second aspect of when the blood sugar has not been maintained by the exercise and diet control, we should think of medication. And the medication has been, of course, we don't have to advise like this. If the person should consult their physician, family physician or respective doctor, who should give them regular medication. To summarize, diabetes is a chronic progressive disorder. It should be understood at the earliest opportunity, and we should take remedial measure as early as possible to prevent any diabetes related complication. Thank you so much. Expect you to like our channel and subscribe. Thank you.